Hello and welcome to the first in the webinar series. This is Nancy Reggio and I'm Director of Marketing here at NAU. And today we join Dr. Smith, who is the Associate Dean of the Online Allied Health Programs at National American University. As you know, National American University offers many degree and certificate programs, and I encourage you to go ahead and take a look at all the options. Visit us at www.national.edu for more information. A few reminders before we kick off the webinar. First of all, your lines are on mute, and we do that to reduce background noise, but we want your participation. So you'll see along the bottom of your screen, there's a question and answer and a chat option. As you have questions, if you go into that and put them there, we'll pick them up at the end of the webinar and answer those for you. Second, we are recording this, so you will be able to get a copy of the recording, including the slides. And with that, I'm going to turn this over to Dr. Smith.
Hello, everyone. I am Dr. LaShunda Smith. I am the Associate Dean for the Online Allied Health Programs here at NAU, as Nancy mentioned. I have nearly 20 years of experience in health information management as a whole. I've ranged from consultant, release of information, and my pride and joy is education. So I just wanted to talk a little bit about what health information management is, what it entails, the opportunities that are available, and we'll go from there. So you ask, what is health information management? It is the practice of acquiring, analyzing, and protecting digital and traditional medical information that is vital to providing quality patient care. But that's not all. Health information management is a field where we promote the migration of the electronic health record. We reinvent how institutional and personal health record information is managed. We also deliver measurable cost savings to an organization based on the technology and advancements of health information management. So I want you to just sit back, relax, and understand more about what health information management is and what it entails. Why health information management as a career option? Well, number one, the diverse opportunities. As I mentioned earlier, I have been in multi-facets of there are so many opportunities and there are so many things that you're able to do within this field. Healthcare coding and healthcare information technology is also continually growing, which is encompassed within this field. Health information management professionals are part of an allied health team and lead the efforts to ensure availability, accuracy, integrity, and security of all data related to patient healthcare encounters, and the result in better clinical and business decisions to enhance healthcare quality. And it's all about making the patient better, even if you're not doing direct hands-on patient care. Also, health information management professionals primarily serve the healthcare industry in departments where patient data and health information is collected and stored, such as acute care hospitals, physicians' offices and clinics, long-term care facilities, nursing homes, even health information software companies, health information consulting firms. The list goes on, government agencies, insurance companies. Let me tell you a little story about why I chose health information management as a career. It all started with an ice cream social. The HIM program at my undergrad institution was exchanging information for ice cream, where you basically fill out some information, you get ice cream, and they give you also information about what HIM is, what it entails. And at that time, I was an occupational therapy major and had just finished 40 hours of observation to understand more about what occupational therapists do. Well, in doing so, I found out that I didn't want to do direct hands-on patient care, which I praise those that are able to do those types of very skilled and very hands-on jobs when it comes to relating to the patient. I still loved healthcare, and when I found health information management as a career option, it basically changed my life. I read through the information. I found out that it was so diverse and that I wasn't locked in to one specific thing, that I can learn about so many different things. And I'll just put it like this: an ice cream social changed my life. So that's my why. You may ask, what are some of the responsibilities or tasks involved in the HIM field? The HIM field combines concepts of number 1, business, number 2, science, and number 3, information technology. Just imagine those types of things being encapsulated within healthcare, and how learning about that information really propels you to do and be successful in the health information management field. Health information management as a field includes health information technicians, analyzers, healthcare coders, and there are other many areas of specialization. And we'll get to a few of those in just a bit. What other responsibilities? HIM professionals add value to a range of job roles. I'm in education, and based on the experience that I have had over my years in health information management, especially in learning hard skills, learning soft skills, I add value to my job. The job roles ranging from clinical coding to data analytics and even education. Managing health information is a growing need in the evolving healthcare industries, and HIM professionals are responsible for managing patient health information and medical records, administering computer information systems, collecting and analyzing patient information, using classification systems and medical terminologies. Also, my favorite parts, managing people in operational units and participating in administrative committees, preparing budgets that are really going to help an organization thrive. And also interacting with all levels of the organization, from clinical, financial, administrative, and information systems that employ patient data in decision-making and everyday operations. I call health information management the bottom line for a healthcare organization, because what we do is so vitally important to ensuring reimbursement for services that are provided, all the way to making sure that the information is accurate, that it's secure, that it's complete, and that it is available and readily accessible for those that are literally doing hands-on patient care with the patient. And there's so much growth in the field of health information management. We are in high demand in all areas. This is mainly due to an aging population that is demanding more healthcare facilities, and administrators, technicians, and other trained individuals are required to manage them and their patients' information. So let's look at why and the growth outlook. Why is this so important? We've talked about the aging demographics and the aging population, and just look at this outlook through 2024. CNBC most in-demand jobs stated that medical services manager, which health information management falls under, has an annual median salary of about $98,000 with a 20% growth outlook through 2024. Description is also called healthcare administrator. The position typically involves in overseeing, directing, and coordinating the medical and health services for an entire facility, hospital, nursing home, or for a specific department or medical practice. And education, most people who work in this field have a bachelor's degree, although some are moving towards the master's degree, and it's becoming even more common. The U.S. News and World Report. This is very credible information here. The 2019 ranking says that medical and health services managers, number 5 in best business jobs, number 13 in best STEM jobs, science, technology, engineering, and math, number 25 best paying jobs, and number 29 of the 100 best jobs as according to the ranking from the U.S. News and World Report. The Bureau of Labor Statistics also has job outlooks that come out yearly. Employment of medical records and health information technicians, 11% projected growth from the year 2018 to the year 2028, much faster than average for all occupations. So that says a little bit right there in terms of where we are now and looking towards the future and being able to learn this information and step into the future. There are several types of positions available in health information management. Last time I saw, there were over 200 job titles in over 40 to 50 different settings, and we'll talk about and touch base on a few here. Health information management needs future leaders. Choose HIM and expect multiple career options, promising security advancement and job satisfaction. And what I have to say is I am truly satisfied. And I say that because I have been able to do so much in the realm of HIM. Once I found my niche and the thing that makes me thrive and have self-actualization, it's like, this is where I want to be, this is what I want to do. I found it within health information management as I was able to also work in other areas and learn so much about the field. Let's review just a few of the positions available in HIM because there are so many opportunities. One is revenue cycle management and coding and billing. The average salary is about $60,000 to $61,000. And what this usually entails is a coding professional where you have medical coding. It may be a revenue cycle manager where you're understanding the bottom line for the organization, case mix indices, how you're being reimbursed, working with insurance companies, clinical documentation improvement specialists. I know some CDIs personally, and you know, CDI and HIM go hand in hand in actually reviewing information, going back to the physicians so that they can actually ask questions to the physician to make the documentation even clearer. HIM revenue cycle auditor. It's not just that you are managing that revenue cycle, but you may have a chance to also be an auditor for the revenue cycle because you understand so much about what you learn in health information, going through health information programs. Also, benefits coordinators. Operations and medical record administration, average salary between $70,000 and $71,000. Things such as positions such as meaningful use specialist, which for electronic health records, meaningful use is almost just what it says. It's making sure that the electronic health record for that particular healthcare organization is being used in a meaningful way. And there are several criteria, but you can become a specialist in making sure that they're up to standards, up to code, up to speed, up to regulations on the electronic health record. Patient or cancer registrar. I have dibbled and dabbled in cancer registry, and it is a fascinating career path. Again, these are all separate titles where you can go and learn more about it. You get that foundation in health information management. There are certain and different certifications you're able to gain in certain positions. And of course, the health information manager and director of health information management all fall under that operations. And again, these are average salaries. Informatics and data analytics. As we have moved as a nation to more technological advances in healthcare, informatics and data analytics comes top notch in HIM. Average salary is about $71,000, and you can be a data integrity analyst to make sure that the data is what it is and does what it does. And also with clinical informatics coordinator, it's like making the systems talk to each other to make sure that that patient information is accurate, that it's up to date, it's complete, and most importantly, that it's secure and not falling into the wrong hands. Project management. We have project management embedded in our curriculum to be able to understand in health information management what that entails, and you can literally become a project manager based on the skills that you've learned in health information management. Research and develop scientists, that's one of my favorite in terms of being able to crunch the data, trend the data, research, gather the data, and director of clinical informatics. And all of these positions fall under the informatics and data analytics. Then you have compliance and risk assessment. I really, really like compliance. I have been working as a consultant for different organizations throughout my tenure. And one of the best parts about it is dealing with and working with compliance and risk assessments to see where you are. You know, are you complying with the regulations? Are you complying with the rules that govern coding? Are you complying with the rules that govern documentation? And also doing risk assessments to understand where certain risks might be in order to fill those gaps. Certain positions within the compliance and risk assessment arena include credentialing specialists, quality improvement analysts, compliance auditors, privacy officers, information security managers, and director of risk management, with the average salary being about $74,000 to $75,000 per year. And then you have more techie IT infrastructure, because again, business, technology, healthcare, all in one. And you have that science, information technology and infrastructure. The average salary is about $83,000 to $84,000. You can be an implementation support specialist, data quality manager, systems analyst. I have several former students who really picked up the informatics, the IT, and the infrastructure piece, and really wanted to learn more about it. And they are serving all across the country in a variety of these actual job titles that you see here, such as data architect and Chief Technology Officer for a healthcare organization. I know. So, where do you find these careers in health information management, you may ask? Well, again, there are so many diverse opportunities, so many different job titles. So there are also so many different places where health information management professionals are needed, such as ambulatory or outpatient health facility, assisted living facilities, colleges or universities, because a lot of colleges and universities have health care on their campuses. So they need someone to be able to manage that patient information of that student population. Consulting practice. Once you find your niche and once you find what you really like to do, you may be able to consult or work for a consulting firm. Emergency medical services facilities, such as urgent cares, a variety of government agencies. Number one being the VA, healthcare associations, healthcare clinics, home health cares and hospices, hospitals or acute care facilities, information technology organization, the list goes on and on, insurance companies, managed care companies, lab or research settings, mental health facilities, pharmaceutical companies, physician practices, public health agencies, and rehabilitation centers. I have one of my former students, she's a director of a rehab center over their health information management department. And so I know that this is just a snippet, but these are the main areas of where you would find careers in health information technology. But just think about it. Where there's health information kept, stored, maintained, gathered, aggregated, analyzed, there is a need for a health information management professional. Let's look at some average salaries by job settings. So in long-term care, it may be about $47,000, $48,000. In a clinic, physician's office, $51,000. Home care, hospice, $51,000. Ambulatory and behavioral between $57,000 to $58,000. And again, these are average. Others, maybe $64,000 if you go into acute care hospital or education, between $66,000 and $68,000. Non-provider settings, $78,000. This may be like your pharmaceutical companies. Integrated health systems, $88,000. In consulting, $98,000. Let's look at some by job level. More so entry level, where you have clerical administrative, about $35,000. Coding professionals make about $54,000 a year. Supervisors, $60,000. If you look at clinicians, that may also be health information management professionals, about $61,000. Analysts, $66,000. Educator, about $70,000. Managers, $78,000. Consultants, $89,000. Directors, $96,000. And executive president and vice president level about $150,000 a year average salary by job level. There's much to say in terms of education and training needed to enter the HIM profession, because HIM encompasses a lot. There's a lot to learn, and there's a way to be able to learn this information. According to himdegree.org, HIM is in growing demand for qualified professionals, and graduates is on the rise. Now is the right time to begin your education to enter into this field. If you're committed to a career in helping others while you stand on the cutting edge of healthcare technology, there's no better time to get started. And I want to give you a little bit more about the training that's needed. One of the biggest things is that people sometimes, when they're looking for a program, they look to see what would fit, me and my situation and my needs. Well, I know that online education presents an excellent option for many of these motivated professionals. Number one, it allows them to maintain their current job and related family responsibilities while enhancing their career opportunities for professional advancement. If you're ready to move into increased levels of expertise and knowledge in the health information management field, now might be the perfect time to do something about your professional qualifications. Let's get certified. Ready to jumpstart your career in health information management? The next step could be earning your associate's or bachelor's degree in health information management from National American University. Here are some references. I know that we had a short but sweet time presenting the information, but we have lots of time for questions, and we'll also be doing a follow-up webinar series with more information to come. So I wanted to turn it back over to Nancy to see if we may have had some questions, and I also wanted to present my information so that if you have more specific questions that may not be addressed here, or if you're watching the recording, you have my information. Just reach out to me and ask any questions that you have. I do appreciate this opportunity to really share my passion, my expertise for the field of health information management. And I really wanted to thank the marketing team at National American University for hosting this great webinar. And now let's get into some of the questions.
Oh, thank you, Dr. Smith. Well, I got some great questions people actually sent to me directly, so let's jump right into them. And also, if people, you're listening right now and you have a question, chat it over to me or put it in the Q&A section still. But let's jump in. So one of the questions is, what's the difference between RHIA and RHIT?
Well, typically the Registered Health Information Technology, that is technician, RHIT, is a credential that is given to someone who successfully completes a 2-year health information technology degree that is accredited by the American Health Information Management Association, which we call AHIMA. RHIT requires an associate's degree. You must have a bachelor's degree from an accredited program to become an RHIA, which is a Registered Health Information Administrator. And additionally, an RHIA typically is a management type position where RHIT is more technical. And RHIAs focus more on, data analytics, health record privacy and security, compliance, data governance. They participate on committees. They're more so on the director level. So hopefully that gives you a little bit more insight into the difference between RHIT and RHIA, which we have both programs at National American University. We have a program, the 2-year program, which goes right into the RHIT credential, and the 4-year HIM program, which allows you to be able to sit for the Registered Health Information Administrator exam. And I have an RHIA as well, so I went through a 4-year program.
Wonderful, thank you. So another question, what skills are needed by HIM professionals in order to be successful?
Let's start with the first, being able to communicate effectively. And being a learner. So those are my top two, and I'm going to give you a small list of others. But let's start with communication. Because HIM professionals are liaisons between physicians, they're liaisons between administrators, they're liaisons between clerks and coders and clinical CDI specialists. You have to be able to understand and know how to communicate effectively. You need to know how to best communicate for your particular audience. It may be that you're presenting to a group of the board of directors versus a group of physicians. You need to know how to be able to communicate effectively in writing, as well as orally, and also your body language sometimes has to fit or match the message that you're sending. And then the second thing I would say is a learner. And when I say that is because no one ever goes into a position knowing everything. Health information does prepare you and does set you up with the right foundation to be able to go into a variety of settings to really show what you have. But there's always an aspect of learning. And then you have to think about technology and healthcare within itself. Regulations change, technology changes. You have different rules to follow. Being able to learn these things at a pace in which you're able to apply what you're learning. And that's how I've been able to really thrive in this industry, is just, learning information and continuing to learn information. We're called lifelong learners. But other skills such as being detailed oriented, really liking, science and computers, really liking the business aspect of it, really liking management and helping to build your leadership skills. I would say that those are some key skills needed by HIM professionals: being able to communicate, being able to learn, being detail oriented, and liking what you're doing. I mean, because there are so many different things in HIM. You say, I really liked the registry as I was doing it, but I really, really like release of information more, because it's a totally different skill set that you learn in terms of foundation in HIM, but you're able to find your niche. Like, I love training, teaching, talking to students. I love consulting, going into organizations and helping them understand where you are, where you want to be, and this is how you can get there.
Fantastic answer. Thank you. We have a couple more here. They're related. What is the major difference between the HIM degree versus the healthcare management degree offered by NAU?
All right, I can say the general consensus among colleges and universities when it comes to HIM versus HCM, let's just say healthcare management focuses on the organization. Health information management focuses on the organization as a whole. We talked about revenue cycle. We talked about being the bottom line. We talked about being liaisons. We talked about having health information technology and security, whereas healthcare management, healthcare management, or HCM, focuses on specific issues like budgeting and staffing. When you're looking at healthcare management grads, they may be those that want to fill those roles in healthcare management, such as CEO or CFO, where they're building those skills, and it's more leadership focused when you're trying to run an organization, versus having more expertise in many different areas as it comes under HIM. Professions in this behind the scenes position is very crucial to helping facilities run smoothly, because it is, again, the bottom line, especially on the HIM side, because you're looking at medical records and you're making sure that they're secure and you're making sure that they're accessible to provide the nurses and physicians with accurate patient files, as opposed to healthcare management is more C-suite related. When I say CEO, CFO, even with those that may have nursing backgrounds, they may come into healthcare management because they want to be a manager in healthcare over nursing. Hopefully that gives you a little bit more insight into the difference between our health information management and our healthcare management programs. And they're both 4-year degree programs.
Oh, very complete. Thank you. So what are some of the committees the HIM professionals are members of in a healthcare organization?
Well, because knowledge of so many different types of things are required to be able to successfully run an HIM department, HIM professionals are on various technology steering committees, clinical documentation improvement specialist committees. They have to be on finance committees to understand, the budgets and where we are with our patient mix. And what that means is the types of population of patients that we serve. They have to be on medical audit committees to be able to understand, if information is inaccurate or complete, how that became, and how to fix those types of things. Policy and procedure and governance, because lots of policies and procedures that govern a healthcare organization all ties back into how that information is treated. So I would say policy and procedure committees, and I'll say the list goes on, because within a healthcare organization, you may have accreditation, where accreditation teams are formed. Health information management professionals are members of the accreditation team. And there are so many more committees that HIM professionals could be a part of. If we're starting a big project in a healthcare facility, they may be on that project steering team, because ultimately in a healthcare organization, the project will be touching some type of patient data typically. So when you're dealing with those types of things, you have to have those experts in health information management at the table during those committee meetings to be able to weigh in and say, well, have you considered this? And only our HIM professional minds think certain ways sometimes, like, oh, I didn't think about it from your perspective. Yeah, so those are some of the committees where HIM professionals are members of, because they're accountable for the quality and availability. They're accountable for the timeliness of the information. If the computer systems aren't acting right, they need to be on certain committees to know if there are issues with, relaying information from one system to the next, et cetera. So those are some of the committees in which HIM professionals are tasked with.
Wonderful. Looks like we have one more question here, and that is, why is knowledge of the HIPAA security rule important for HIM professionals?
HIPAA is HIPAA. It's not HIPPO. Well, it's a pet peeve of mine when I say HIPAA. The acronym is HIPAA, and some go HIPPA. With HIPAA, the Healthcare Insurance Portability and Accountability Act of 1996 went into effect in April 2003. Ask me how I know that. I had to do a project on it at my first job out of college, because I worked in HIM all through college. And knowledge of HIPAA for HIM professionals, mainly because you're directly responsible for managing the flow of that healthcare information and making sure it's not compromised, making sure it's not breached, making sure that it's not cyber attacked, making sure that it is private, that it's confidential, and that it is secure. Because if these rules aren't followed, it could carry a hefty price for the organization. There are actual penalties associated with not complying with HIPAA, and that is one of the cornerstones, meaning one of the foundational bricks that you learn a lot about in health information management and beyond. That's why I said that second skill needed is to be able to continue to learn, because as we've looked at HIPAA, there have been some addendums and amendments to make it broader in scope. When we had the Affordable Care Act come into play, there were certain HIPAA standards that needed to be followed in order to make that program successful. So as an HIM professional, it is key, and this is why, to understanding HIPAA, because you're ultimately responsible for that patient data. Have you heard about different types of cyber attack? Right now, I'm in Alabama. Right now, I was reading an article Friday. When I just talked about my first job, I was in records compliance. My organization 20 years ago, they have been ransomwared, meaning all operations shut down until they pay a ransom. So in order to help try to prevent things like that, and this is why you need to understand HIPAA, is because the privacy and security team and the IT and infrastructure team need to understand, you know, how to protect these types of things. And there have been things put in place since, but they had to shut down. Other than critical people who are in critical need, they had no computer systems. Just imagine if where you are had no computer systems, had no way to communicate by email, had no way to look up patient information on the electronic health record. So that's why it's very, very important, very, very important.
Oh, wow, I can hear that. Thank you so much. Dr. Smith, this was fantastic, so I really want to thank you for your time. We've answered all the questions, and I think that you have given such a comprehensive overview. I am sure people will be reaching out to you directly with any specific questions. And thank you to everyone who's attended. Please watch for the announcement of our next webinar, which will be in November, and we will be in contact with all of you to get these slides to you. So again, thank you so much on behalf of National American University. Have a great rest of the day.
Thanks, everyone.